हेलो फ्रेंड्स, आज हम एंटीरियर कंपार्टमेंट ऑफ द आर्म की एक मसल को कवर करेंगे। दिस इज़ नोन एज बाइसेप्स ब्रेकाई। ऐसे तो एंटीरियर कंपार्टमेंट ऑफ आर्म में देर आर थ्री मसल। वन इज़ नोन एज बाइसेप्स ब्रेकाई, देन यू हैव द ब्रेकियालिस, and the third muscle is coracobrachialis. So we will see the detailed anatomy of bicep brachii today. So you can see here, this is bone, this is scapula bone, and this bone is humerus. Then lower down you will find the radius on the lateral side and the ulna on the medial side. So you can see here one process of the scapula, that is known as coracoid process of scapula. Then this labrum is known as glenoid labrum. So there is one small tubercle just above the glenoid labrum, glenoid cavity, and that is known as supraglenoid tubercle. तो supraglenoid tubercle क्योंकि ये glenoid cavity के इसके लोकेशन जो है ऊपर है, इसलिए इसे हमने नाम दिया supraglenoid tubercle. दूसरा छोटा सा ट्यूबरकल जो होता है ग्लिनॉइड कैविटी के नीचे होता है, जिसे हम कहते हैं इंफ्राग्लिनॉइड ट्यूबरकल. सो बाइसेप्स ब्रैकियाई के बेसिकली देखिए दो हेड्स होते हैं, एक शॉर्ट हेड होता है और एक लॉन्ग हेड रहता है. सो द शॉर्ट हेड इज़ गोइंग टू अराइज फ्रॉम द tip of the coracoid process. So you can see here, this is the short head of biceps, and the head is long head of biceps is arising from the supraglenoid tubercle. These two head, they form the belly of the biceps brachii, and they are going to insert into the head. Just there is a tuberosity into the radius. That tuberosity is known as radial tuberosity. So this tendon of biceps brachii is going to insert onto the radial tuberosity of the radius bone. So at the point of insertion, this bicipital tendon get flattened, and it is known as bicipital aponeurosis. This bicipital aponeurosis is going to fuse with the deep fascia of the forearm region. So we have seen the bicep brachii is having two head, the short head arising from the tip of coracoid process, the long head arising from the supraglenoid tubercle of the scapula. Then it is going to insert onto the posterior rough part of the radial tuberosity of the radius bone, and the tendon gives off an extension known as bicipital aponeurosis. So this bicipital aponeurosis extends to the ulna, and it merges with the deep fascia over the muscle of the forearm, anterior compartment of the forearm, and it separates the median cubital vein from the brachial artery. So you can see here, this is the extension of the tendon of the bicep brachii. This is flattened part, and this is known as bicipital aponeurosis. So the nerve supply of this bicep brachii is by the musculocutaneous nerve, which is arising from the lateral cord of the brachial plexus with a nerve root value of C5, C6 and C7. The function or the action of this muscle, that is bicep brachii, is it causes flexion of the arm. It also causes flexion of the elbow, because this muscle is crossing two joint. It is crossing the shoulder joint, and it is also crossing the elbow joint. So this performs flexion at these two joint. It also flexes the elbow as well as the shoulder joint. It also performs the screwing movement, and it is a strong supinator of the forearm. So this is about the bicep brachii, which is one of the important muscle of anterior compartment of the arm. So thank you for listening. Next we will see about the next muscle of the anterior compartment of the forearm, the arm, that will be your coracobrachialis and brachialis.